So switching gears now, 'tis the season, right, for allergies, but what causes them and how do we manage them? We have Dr. Anita Savam here. She is a board-certified allergist with family allergy and asthma, and I was just telling her, I said, I have had this weird voice thing for a while, but everyone's like, are you okay? I'm like, I feel fine. But is there something in the air, doctor? I'm like, maybe there's some sort of allergy that I have and I just don't know it.
It absolutely could be. We're in spring allergy season right now, so that can definitely trigger some symptoms.
Absolutely. Okay, let's talk allergies and sort of a lot of what you do. What do we need to be on the lookout for this time of year?
So spring allergy season, generally trees right now, and then late spring, also the grasses as well.
Okay. Is this something too with allergies? I know my sister's daughter had problems with these, and a lot of people have to get tested, right? What's the typical process for something like that if you think, okay, I might be allergic to a little something?
So if you're suspecting you're allergic to something, generally we want to do allergy testing. So that basically involves dipping some plastic toothpicks into water droplets that have the different allergies in them. We test for about 80 different things.
Oh, wow.
Trees, grasses, weeds, cats,
and
dogs.
Are those the most common allergies?
Yes.
That you test for, and that's what you have right here.
Yep. So this is one of the toothpicks that we use for the allergy testing. We dip them into different wells that have the allergies in them, and then we scratch the patient's back and then wait about 20 minutes. And if you're allergic to something, it'll turn into like an itchy bump or a hive.
I've seen those pictures on social media. People talk about that quite a bit. And it's interesting, too, treatment plan. How do you manage this, and is it different for everybody?
Sure. So the three main ways we deal with allergies, first is avoidance, but of course, some of these things we generally can't avoid.
Right.
Two is with medicines, but of course, we're just dealing with the symptoms with medications. We're not actually dealing with the root cause of the problem. And lastly is with immunotherapy or allergy shots. That basically is trying to change the immune system so it doesn't get as affected with the allergies as it usually does.
It's interesting because I would imagine there's different severity too, because my husband has had allergies and he takes some medication and it's just something very simple. I'm thinking I might have a little something, but I feel fine. Then other people you see have really severe reactions. So are there all different types of stages essentially?
Yes, absolutely. So there's different degrees of how symptomatic you can be from allergies. Like you said, mild symptoms to more severe symptoms where it's affecting the respiratory tract, triggering asthma, things like that.
Is a lot of it, is it environmental? Is it genetics? Like, what do we need to know about, okay, why do I have this? Where did this come from?
Allergic conditions can definitely be genetic, but it is also environmental triggers. What's in your environment? If you live in a dusty environment, have pet dander affecting you, things like that.
Is there a certain age range, especially, after we have a baby, that a lot of us as parents, right, we get a little concerned. I don't know if she's allergic to peanuts. I don't think so. Is this something that we should do when the kids are young, or what would you recommend?
It definitely depends on if they're actually symptomatic. We don't want to just blindly test everyone, but if they're symptomatic, then I would definitely recommend seeing an allergist at an early age.
And is that scary for some people? Do they have hesitations to come in and get tested?
Absolutely. When you see on social media the big allergy test, everyone's like, needles, but we don't. We are very cautious, especially in children. We have different ways of testing, so we make sure it's comfortable for the patient and get them through it.
Okay, anything else we need to know for perhaps our fellow people who have allergies out there who might in the future?
I would definitely recommend seeing an allergist if your symptoms are not controlled, so we can talk about more permanent treatment options.
That sounds great. Doctor, thank you so much for your time, for your knowledge, your expertise. We appreciate it so much.
Thank you for having me.
All right, guys, on over to you.